Equalization. The parts of our body affected by the compression of the gases during the dive are mainly the internal cavities connected to the respiratory system. These cavities which contain air are affected by this physical phenomenon. While for the lungs, the phenomenon of reduction of the volume of gases during a dive triggers an automatic compensation mechanism called blood shift, which will be dealt with later. As regards the middle ear, it is necessary to act using equalization maneuvers aimed at rebalancing the tympanic membrane, which is pushed by the hydrostatic pressure towards the inside of the ear. The ear is divided into three parts: the outer ear, a simple open cavity that does not require equalization; the middle ear, a gaseous cavity separated from the outside by a membrane called the tympanum; the inner ear, composed of solid and liquid materials and therefore incompressible. The middle ear is the part subject through the eardrum to the phenomenon of the compression of gases. As you dive deeper, the pressure increases, the eardrum introflexes, and if it is stretched too much, gives rise to a fastidious sense of compression, which turns into pain as the descent continues. Continuing the descent even further can cause the tympanum to rupture. Fortunately for us, the middle ear is connected to the mouth through a small duct, the auditory tube, also known as the eustachian tube. With some special maneuvers called equalization, we can emit air into the middle ear from the throat to compensate for the external pressure. The eustachian tube is normally closed to prevent bacteria from entering the middle ear. To open it, it is necessary for most of us to create a slight overpressure in the nose. Generally, this is done by performing the Valsalva maneuver. You pinch your nose with your fingers and gently blow into your nose. However, the Valsalva maneuver, widely used in scuba diving, is not efficient for freediving. For a freediver, it is particularly difficult to use the abdominal muscles to push the air downwards from the lungs to the middle ear, creating the overpressure needed to compensate for the pressure difference. In general, freedivers prefer the Frenzel or Marcante Odalia maneuver. You pinch your nose, close your mouth using your tongue, and lightly press the tongue towards the throat. Your PSS instructor will show you practically the techniques you need to use so as to implement effective equalization. With this action, we equalize the pressure not only in the middle ear, but thanks to internal ducts, also in a series of gaseous cavities of the skull called the paranasal sinuses. We recommend that you do not dive when you have severe sinusitis or a bad cold. In fact, in these conditions, the occlusion of the paranasal sinuses or eustachian tubes can prevent you from performing the equalization maneuver, and not being able to equalize means that making a freedive becomes impossible. If during a descent you feel a sense of painful pressure in your ears and you can't equalize, you must stop and ascend. You can make other attempts trying during the descent to equalize continuously, but gently. If you do not manage to equalize, it is useless to force it, and for that day you have to abandon the freediving excursion. We also have artificial cavities separated from the outside by a membrane. One of these is precisely the air cushion enclosed in the mask. As the mask skirt is soft, this air cushion reduces in volume under the effect of the increasing pressure. However, when the mask is no longer able to deform, for example, because the rigid frame is pushing on the nose, the pressure inside is lower than the external one. If the difference is great, the ocular capillaries can break, resulting in the leakage of blood, which makes the eye red. Avoiding this effect, called mask squeeze, is in any case very easy. Just blow a little bit of air through the nose into the mask during the descent.